All right, so I'm Bob McNamara. This is the infamous Mark Reiter. So we're both past presidents of AAEM. Mark is the CEO. I'm the Chief Medical Officer of the AAEM Physician Group, which, as you notice, this is the AAEM Physician Group versus Envision. We're going to be talking about the lawsuit. So the objectives listed for this course are define the corporate practice of medicine, how it harms patients, summarize the suit. Mark will take that on. And then I believe Lisa and Jonathan will join us up, and we'll talk about what can be done in the future. So I'm going to start off with a little bit of the sort of background. When the specialty of emergency medicine was founded in 1968, 8 physicians wrote the original bylaws of the American College of Emergency Physicians. They actually, in their statement of purpose and their statement of function, they said they're going to preserve the ethical standards and the integrity of private practice, i.e. owned by physicians, private practice. So this is really interesting that we're here today talking about fighting corporate practice. In their ethical statements in the bylaws, they had certain things that AAEM really believes is core. You don't exploit colleagues. You will not profit off the labors of your fellow physicians, fellow ACEP members. Essentially, you won't be doing fee splitting, charging somebody an amount of money to see patients in the contract that you own. And there's an explicit statement not allowing non-physicians to practice medicine, against the corporate practice of medicine. Now, Envision is the player besides the PG. Little history on that. We understand there's a lot of younger doctors here. We've talked about this at the past president's level about getting more education as to the history of emergency medicine. So EmCare became Envision. It was founded by the 1980-81 president of ACEP, Leonard Riggs. He sold his company to Laidlaw in 1997. One of our board members, Scott Plants, had bought a share of EmCare, and it was evident that they had a 20% profit level from their operations, made them attractive to Laidlaw, a lay company, and Dr. Riggs made $37 million in that sale, selling the right to take a 20% profit level off of ACEP members at the time. Now, Laidlaw then sold out to private equity. I think this is the first entry of private equity into emergency medicine. Onyx Investors, they're now in with Schumacher. It was resold, and it briefly went public under the sticker EVHC. And then went private again, merged with AmSurg, Ambulatory Surgery, to become Envision. And then they were acquired by KK&R, one of the largest private equity firms, for $9.9 billion in 2018. So that's the history. This is clearly a lay entity, right? This is owned by private equity. The corporate practice of medicine doctrine, give you a little background on that. It essentially says a business cannot employ a physician, okay? This is to keep the influence, the business influence, out of the physician-patient relationship. These began in a lot of states back in the 1940s and whatnot. Companies would have doctors who would say, this is not job-related, and the labor union movement was strong, and the states passed this and various things to say, we need to protect the physician from being influenced by the corporation. So a lot of these go back. You can have case law and rulings back in the 40s if you go state by state. It's not just doctors, right? It's learned professions. Dentists are included in this. Lawyers are included in this. So key, you're in a legal case. Keep the business interests out of the lawyer-client. Well, you're an attorney, you're defending Envision, but you can't do this with your own clients now, can you? So that's a key issue, I think, that a lot of people don't understand. The penalties on lawyers are way worse, and they're enforced than on physicians. Disbarment, okay, that they go that far. And they also don't let you impose restrictive covenants. All right, so most states have some form of this. Some it's weak. Certain states it's pretty strong. Texas, big state, right? Home state of Envision. That's where they were founded at, and now they're headquartered in Tennessee. California, where this suit is being filed, and other states have some pretty strong laws. Trouble is lack of enforcement. Okay, so theoretically, who's this is a protection for the public, who's going to do this? The state attorney general, the state medical boards. So we've had some cases over the years which we can talk about briefly, but the AG will not, in some states they have stepped up and actually actively pursued this based on consumer complaints. The New York chapter, I sent them the Aspen Dental ruling where the state attorney general got consumer complaints and said this is an illegal structure. This is a corporation owning all these dental practices. But we've petitioned state attorney generals. Sometimes they'll only act if a legislative body asks them. State boards of medicine, they always say, look, we can only do the doctors. We don't really have any control over these corporations. You would think that they would be, working for violations of the corporate practice of medicine. But as is now, often you have to go to court. So that is essentially where we stand in California. So one of the things that we're attacking is the sham professional association, professional corporation structure. This is the vehicle that all the big groups are using to say, we are aware of the risk of being found illegal under the corporate practice of medicine, but we have set up this friendly, captive, paper owner, fake thing. There are multiple cases, court cases, that have ruled against that. There's 2 in Texas. Flynn Brothers says you can't have a contractual scheme to skirt the intent of the corporate practice of medicine prohibition. Xenon was a more recent one. There are some rulings. There's one in Jersey, an all-state case. So what has happened in our specialty is that EM physician leaders have lent their name to private equity in order for them to skirt the corporate practice of medicine law. Now these doctors are at risk for their licensures. There are multiple rulings about aiding and abetting the corporate practice of medicine. Certain states you can look and find board actions where a lot of it has to do with these accident mills where somebody sets it up and a doctor lends their name. So you can't do that and you can have your licensure censured. And some of us are taking some actions along those lines as well. So in their statements and when they were public, this would be one of the things they would say. We're at risk for corporate practice of medicine violations. We think we have that under our way. This is the vehicle that we're using to do this. Most of you probably, if you haven't read the case, Ray Brovant was fired by Envision for speaking up about the quality of care. He won $26 million in court. And there's the final ruling from Missouri. We've shared that multiple times. It was written about in EP Monthly. In the court documents, Dr. Gregory Byrne, past Texas ACEP president, admitted to holding 275 to 300 professional entities in 20 different states for Envision. That's a sham, okay? He's not working in 275 EDs in 30 states. And he's not, and the doctors who don't even know him. The same thing if there was a ProPublica article that I was interviewed for. It discussed the case of Molina Healthcare and Team Health fighting over payments. Dr. Lance Williams, in his deposition, testified to over 50 professional associations in 7 states, okay? So these are examples of physicians that are, lending their name. And, with Lance Williams, and I am sure with every other one, it was shown that at the same time he took ownership of this professional association, would immediately sign a stock transfer restriction agreement, which essentially says you have no power. You can't issue stock, dividends, or sell this professional corporation without the consent of Team Health. We will remove you if you try to do that. All right. I lost my... So, this, for me, this bottoms down to patient care issues, right? This is why AAEM formed. This is why we're fighting the corporate practice of medicine. Our first duty, you swear the oath, is to the patients. First duty of a corporation is to the investors and the shareholders, all right? And then we also know due process doesn't exist for physicians working in these arrangements, and obviously profits before patients is the great concern here, and there's evidence out there, okay? But then the effects on us as well, okay? I don't have to tell you, we can have lectures on this, but we are, one of the most stressful professions out there in the medicine. We certainly, we're at the top again in burnout, right? 60%, I think, was Medscape's survey last year. all the stuff that you go through, and you can't do difficult jobs when you feel you're being taken advantage of. And that was sort of like the thing that got me into getting involved with the corporate practice at AAEM, reading The Rape of Emergency Medicine, what the reader said. I feel like I'm being taken advantage of. I was like a lamb getting led to the slaughter after leading my residency. It's just, I'm like, whoa, wait a second. We're doing a difficult job and we feel somebody's taking advantage of us. That's destructive to us. It leads to burnout. When you talk to physicians why you're burning out, loss of autonomy is a very common thing that physicians report. And obviously, working for private equity, you're going to feel that. And then if you're a burned out doctor, you're not taking the best care of your patients, right? Okay? And then let alone the effects on your family where you don't like your job. You're miserable before you go into your shift and after you come after your shift. And it's, we see talks here, right? Suicide rates among physicians, depression, burnout. So this is a core issue, all right? We've got to be well to give the best care to our patients, and we can't have private equity in there. So if you haven't ever seen this, okay, this is a clear example of why we shouldn't have private equity in emergency medicine. 60 Minutes episode from 2013. I helped Sam Hornblower put this together. They came to AAEM. We had actually been on 60 Minutes, AAEM people, myself, Jim Keeney, way back when with Mike Wallace in 1993. And essentially, this described a situation where emergency physicians working for EmCare and the for-profit HMA chain, which is now defunct, were pressured by EmCare to have admission quotas for grandma, right? Over the age of 65, you want to admit X number. We expect half of the patients who arrive over the age of 65 to be admitted. That's like completely wrong. It's interfering with medicine. They were coerced to order more tests and threatened with firing. And again, there's a amicus brief, not amicus brief, it's a qui tam action that was filed by Werner and Cowling, and they paid fines to this, but it's an example of why you have the corporate practice of medicine prohibition. And then, they're deciding who's seeing the patient, right? We're all fired up about writing position statements about non-physician providers and whatnot and fighting here and there. Look, whether they have independent practice authority or not, I think we have to fight that, but who's calling the shots is who is the staff, okay? And these companies, they want to use the cheapest provider, the least expensive resource to accomplish the mission. APPs can see a lot of patients, and then you can roll on. Like, they don't want even emergency medicine. Family practice is cheaper, and then the last bullet is senior residents, but they're only cost-effective in their third year. Don't take a second-year resident. And then finally, they advertise this to hospitals, right? Envision Physician Services, hey, we're going to put in APPs that cost 2/3 of what a doctor does. So again, this is part of our concerns as the Academy and why I think this case is so important. And I'll turn it over to Mark. And we're done with the slides right now, so we can shut those off, and Mark is going to talk.
Good afternoon. Our story starts in Placentia, California, about an hour east of Los Angeles. A doctor named Peter Anderson was a single contract holder of Placentia Linda Hospital's emergency group, as well as nearby Fountain Valley. Now, when he was nearing retirement, Peter Anderson did something very different than what most other doctors would do. Most would maybe sell out to Team Health or Envision, and he instead took the very generous step of actually gifting these two emergency groups to the doctors that he had been working with for many years. And we started up two new independent emergency medicine groups. And for that, he was honored with the AAEM John Wagner Award recently to recognize this great thing that he did. Now, these two new independent groups, they contracted with what was also a relatively new entity, the AAEM Physician Group that Bob and I helped to run over here, that provides practice management and consulting and advisory services to help existing independent democratic groups be more successful and to help start up new independent democratic groups. And that's what we did. We helped them with the group structure and governments and all the different aspects of getting a group up and running and being successful. And things were working quite well for several years. The problem is that Placentia Linda Hospital is part of Tenet Healthcare. And Tenet Healthcare is one of the larger for-profit hospital chains in the country, has a big presence in the state of California. And Tenet does not value what we bring to the table as emergency medicine groups. See, what Tenet values, in my opinion, is profit, profit, profit above everything else. So for many years, they've been trying this scheme, and in 2016, they put all of the emergency groups under their banner at their hospitals, different groups, independent groups, some CMGs, up for bid in a scheme where they asked one contract group to come in and take all their anesthesiology practices that were losing money and all their hospitalist practices that were losing money, and they were paying $50 million in subsidy, and to take on all those losses with the prize being, we'll give you all these profitable emergency groups in return. Forget about what was best for patients and best for the hospital and things like that. Now, I was national president of AAEM at that time, and we fought back very hard against that. We met with Tenet leadership, we helped organize the doctors, we threatened litigation, and we were very aggressive in the media that Tenet was putting profits ahead of patients. Tenet backed down. They told us, after a lot of bad press, this was a big misunderstanding. We had been confused, all of us and all the different groups, about the issue, and they were going to continue business as usual. But they did continue on an individual hospital basis to try this whole cross-subsidization again that has happened through other hospital networks as well across the country. And last year, it was Placentia Linda emergency physicians' time to get targeted. So the hospital network cut a deal with Envision that they can take on the anesthesiology group that was losing money without a subsidy, with the prize being that you can take on Placentia Linda emergency physicians and make profit off of them. And that's what ended up happening. The doctors were told that, hey, in a few months, in September, your contract is going to go to Envision, and this is a great thing. You're going to have new owners and all of that. And they weren't very happy about that. And Bob and I and the AAEM-PG team, we worked with the group, a big action plan of different things we can do, but the more aggressive, effective things that we can do that had worked in the past with Tenet would be being aggressive in the media, threatening litigation, going ahead with litigation. And after a lot of thought, the group decided that they did not want to take those steps and that they were going to allow this to happen. They felt that if they fought back hard and they were unsuccessful, that they would be blackballed by Tenet, they would be blackballed by Envision, and they would not have local job opportunities and would have to uproot their families. So it was a difficult decision. We would have liked to have, fought really hard. We think we would have won, but ultimately the decision was to allow this to take place. And Envision took over the contract in September. Now, Envision, as you heard, is clearly a lay corporation. They were bought for almost $10 billion by KK&R just 4 years ago, okay? It is not a 100% physician-owned corporation. It's a 100% private equity-owned corporation. California has very strong corporate practice of medicine laws. It says explicitly that non-physician entities, lay corporations, can't own physician practices or control physician practices, that they can't directly or indirectly hire physicians. They can't make business and administrative decisions that impact the practice of medicine at their facilities. They give some more detail and examples and things like that. So when Envision, a lay entity, is the one who is contracted with insurers, controlling physician professional fees, setting physician compensation, hiring and firing doctors, setting staffing levels, and setting up a tremendous amount of different policies and procedures that impact how you practice medicine, that they, in our opinion, very clearly are violating corporate practice of medicine laws in the state of California. We went ahead in December after doing all of our due diligence, and we filed suit to that effect. We also filed suit to the effect that the restrictive covenants that they are putting in place to control doctors during employment and after employment, to keep them stuck at that institution without other job options, that was also illegal in the state of California, and that when they offer up anesthesiology services that are money-losing without a subsidy, that essentially is a veiled kickback in exchange for the emergency medicine contract, and that would be illegal as well. So we went ahead and we filed suit, and we filed suit in December, and I'm also happy to say that we've had a lot of great support. There's been a lot of media coverage about this, but the most important medical organization in the state of California, the California Medical Association, they put their legal team to work to draft and submit an amicus curiae brief, a friend of the court brief, supporting our position. And they've got a lot of clout. To their credit, the American College of Emergency Physicians had their legal team work to write an amicus curiae brief and submit it in support of our position, a very big step for the college. And we're right now in the midst of what will be a multi-year, multi-million-dollar legal expense litigation, and we'll see how this plays out over here. And it's going to be very expensive, and we really need support from our members, so I'd highly encourage you. You're going to have the option of donating your registration fee to the AAEM Foundation, which is our legal fund for this, and I hope you'll do so. Now, what does Envision say? Envision says, you've got it all wrong. We're not actually doing any of the things that you're saying. You're probably thinking of Glass Beach Emergency Physicians. That's a physician group that is doing all those things, so that's totally legal. Now, we think that's a bunch of crap, okay? So Glass Beach Emergency Physicians was founded in 2012. It existed really solely on paper. Nothing was happening. It's one of hundreds of different shell corporations that Envision and all these other contract groups just create as legal entities for the express purpose, in our opinion, of violating the corporate practice of medicine. And we think that a good court and a good judge will pierce the corporate veil and recognize this sham for what it really is. So what do? They put these, paper owners, in charge, these straw man owners. The initial one was Charles Mitchell, a physician in Hawaii. And then they moved his name eventually to other non-physician Envision executives over the years as the controller for Glass Beach Emergency Physicians, which again, it just existed on paper. And then in advance of them actually using this shell corporation, when they put Placentia Linda Emergency Physicians into Glass Beach Emergency Physicians, then they changed the owner to Dr. Douglas Smith, who is the head of all physician services for Envision. So, as far as we can tell, when we did our research, none of these people have medical licenses in the state of California. They probably haven't been to Placentia Linda Hospital. They don't have anything to do with any of these doctors involved and aren't involved in the day-to-day decisions of running an emergency medicine practice in any way. Again, as Bob told you, a lot of these people, they've got their names on hundreds of these different companies. Okay? They exist solely to break the law in violation of the state of California and other states' legislative intent that the corporate practice of medicine should not happen. So we are going to do our part to pierce this corporate veil and to get the needed justice that's deserved. So we're confident about our case for a variety of different reasons. For one, I think we've got the right case. The facts are on our side. It's pretty clear that the whole point of Glass Beach Emergency Physicians is just simply to be a contractual entity to allow the physician professional fees to flow through it, and it all goes to Envision, and there is no question that Envision staff is doing all the work, and there's no question that Envision is the one who is getting all the profits. Envision is not a $9.9 billion company when it was acquired a few years ago, simply because they share all their profits with the Dr. Charles Mitchells and the Dr. Douglas Smiths and things like that. They keep those profits, okay? So you have a non-physician entity that's really controlling things. So we think we've got the right case. We think we're in the right state. California has strong corporate practice of medicine laws, and California judges, we think, aren't terribly partial to private equity corporations controlling medicine at the expense of patients and the physicians that are serving them. In addition, I think we've got the right attorney, okay? We've got David Milstein is our attorney. We're very familiar with David. We worked with him before. We think he's probably the best corporate practice of medicine guy in the country. In the late 1990s, Catholic Healthcare West, a large hospital network, they decided that, hey, all these physician practices are making money on physician professional fees. You know, doctors are doing the work and they're making money doing it. It would be better if we made that money. So they created an entity, their own physician group, where they took all the different physician practices and put it all in there, and it was owned by the hospital so that they could be the ones profiting from physician professional fees. So the Academy did spring into action here, and alongside the California Medical Association, we sued this entity in Catholic Healthcare West in the state of California in the late 1990s, and we used David Milstein's firm, and he did a lot of work really researching the corporate practice of medicine. He was our lead attorney, and we were very successful. Eventually, Catholic Healthcare West felt that they were going to lose. They gave up their whole plan. They returned all the physician practices, and they made everybody whole for bringing the litigation. And we stopped what would have been the precursor to hospitals all across the country taking over all the emergency physician practices. So we think we've got the right attorney. Also importantly, we're comfortable that we have standing in the case. See, AAEM Physician Group was providing practice management and advisory services to Placentia Linda emergency physicians. We don't charge much. We're just trying to help out emergency practices. They were paying $20,000 a year as a low volume practice. But we were harmed because Envision's illegal takeover, that contractual relationship was dissolved because of their illegal action. As a harmed party, we have standing to bring the suit. Now, in the past, such as in the late 2000s when AAEM sued the Memorial Hermann Health System when Team Health took over that system, and we felt that was illegal per strong corporate practice of medicine laws in the state of Texas, and we had a great case. Unfortunately, our great case was dismissed, and it was dismissed early on because the judge ruled that AAEM, as a membership organization, as a professional organization, couldn't say that because our members were harmed, we were harmed. Now, we very much disagree with that, but hey, the judge's decision is final over there. But here it's different. We have standing, and that gives us a lot of power. And when we were envisioning starting up the AAEM Physician Group back in 2016, we wanted to really provide as much help as we can to existing groups and groups that wanted to form, but we also wanted to fix this problem that we ran into in Texas, that if one of our groups was threatened, that we would have the standing to really see things to the end. Another strong part of the case is that, again, after a lot of consideration, the Placentia Linda emergency physicians felt it was not in their best interest to fight back, and they are not joining, they are not party to this lawsuit. They very much support what we're doing, okay? They're rooting for us, you better believe that, but they're not party to the lawsuit. And that gives the Academy a lot more flexibility, because in the past, such as 15 or so years ago when we sued in the Mount Diablo case against Team Health when they had them all in restrictive covenants, and they were at a CEP hospital, now Vituity, and Team Health came in and said, you can't work here anymore without paying us a huge amount of money because you have restrictive covenants. And we said that's illegal in California, and also even you coming in here is against the corporate practice of medicine and things like that. Or in the case around the same time, a few years later in Minnesota with the EPA group, an independent group that Envision came in and took over the group, and they lost their contract despite strong Minnesota corporate practice of medicine laws. And we joined with EPA saying that, you can't do this, okay? In both cases, we had strong cases, and I think we probably would have won if we went to the end, but we went alongside the group, and in both cases, we won pretty early on that Team Health backed down, Envision backed down. They let the Team Health docs remain without paying any money for restrictive covenants, and they made everybody whole in terms of other expenses. In Envision, Envision actually took over the contract at EPA in Minnesota for several weeks, and then they made the decision to give back the contract. I don't know if that's ever really happened before, and EPA came back in and took over again, and it remains a successful independent group to this day, 15 plus years later. But we didn't get to a judge's decision in either of those cases because the contract group was threatened enough to back down and make all these groups whole and make the problem go away. We're not letting the problem go away this time, okay? We're gonna, take this one to the mattresses. We're gonna go all the way over here, okay? It's too long that emergency physicians have been, bullied by these lay corporations, now pretty much all private equity backed, that are controlling doctors, that are owning doctors. Enough is enough. We have the right case. So we are going to go all the way with this. We want to put a dagger in the dragon's heart here, and we are going to win.
All right, folks. So I want to let you know, the people that applause is for is the AAEM Board of Directors that voted to do this, okay? Those folks, led by Lisa, we got Jonathan, you guys want to come up? We're going to talk about a little bit about the last phase is what can be done, where do we go? If you guys want to be up here, we'll cut it. So we got the suit filed. What's next? Where do you go? I'm an individual member of AAEM. Maybe I'm not a member. What can happen? So we're going to be up here for questions. The foundation, which Mark mentioned, clearly needs support. Okay, so if that money is going to support this lawsuit. The foundation has also been used in multiple different cases to protect individual physicians, to help physicians who were terminated to fight back. Sort of the Brovon type matters. So that's it. The foundation was created to support you, the individual doctor's efforts, and now this is a critical thing for the specialty. So donating there, being a member, get other people being members. If you're in a group, what Mark said, you really ought to consider joining the AAEM physician group for the protection. All right, now one of the consequences, like we did have a group from California say, hey, we're under the gun, and now they became part of us. We'll do the same thing we're doing for Placentia Linda that we would do for them. And we've had one prior success with threatening to have litigation for the corporate practice of medicine in one of our Texas groups that they were able to keep from becoming Envision employees. So those are some real actions you can do. Getting the word out, becoming informed about it, informed on the board certification issue and the corporatization of emergency medicine, which everybody dislikes, except for, I guess, the corporate docs. The colleges surveys say that, okay? We're not against ASAP members. We're not against people that work for corporate groups. It's our fault. It's my generation's fault that we got to this point. Those original bylaws, I showed you one person that became the president. They stripped the bylaws, okay? They tied the organization's hands with an antitrust policy. We finally have seen some movement. That's a major victory. If it wasn't for the AAEM, you would have never seen a statement by ASAP against private equity. You would have never seen an amicus brief. So we can compliment ourselves as an organization on that success. And we're ready to take any questions from the audience. And you guys want to add anything?
Yep.
First, I just want to make a comment, or two comments. Your board took this very seriously. We have a history, AAEM has a history of being extremely fiscally conservative. Issues come up, are we going to spend money on this? I don't know, it's too much money, this was something that the board gave extreme deliberation to, a lot of discussion to. When we decided to put all this money at risk, we decided to do so because we believe exactly what Mark said, that we are going to win. We looked carefully at the possibilities. We looked at the issues that he mentioned. Are we going to be thrown out for lack of standing? The state, does the state favor the individual over a corporation? The attorney, Bob did a lot of research. He knows the attorney. We gave all of these things really, really careful consideration. So I want to assure you that we believe, absolutely, this is not hype. We believe we're going to win, and that's the reason that we're doing this. The second thing is that, for me, during my presidency, this is a social justice issue, y'all. Doctors are being abused. Doctors are being bought and sold by these corporations. If you work for a corporate medical group, you need to belong to AAEM because we defend you. We're standing up for you. You are being bought and sold like chattel. They are selling your services to the hospital for probably like, I don't know, I'm making this up, $500 an hour, and paying you, and I'm making this up too, $250 an hour. They are making buckets of money on you. They are abusing you. They are disrespecting your knowledge and training by setting metrics that are profit-driven and have nothing to do with the patients, have nothing to do with your medical knowledge. They totally disregard you. They totally disrespect you. And they totally disregard and disrespect the patient. And it's a justice issue for physicians, and it's a justice issue for patients, because the uninsured, the underinsured, the poor rural whites, the black and brown people, people with low health literacy, people who aren't fluent in English, these are all the people, oh, and Jonathan's, the people that he stands up for, people who are immigrants who do not have legal status. So all of these people are the people that are being disregarded because they are not a source of profit to Envision. And so Envision doesn't care about them. So if you have any doubts about whether you should be donating to the foundation, I'm going to tell you first, you need to donate to the foundation and support this lawsuit because it's about you. This is about your self-preservation. You need us to be able to follow this lawsuit to the end. And the second reason is because you're an emergency physician, you stand up for your patients. So contribute for your patients. Contribute because we want equitable care. Contribute because you want to be able to give the best to every patient every single time. But if that doesn't sway you, contribute to save your job and to save our profession.
I'll be brief, and because I see we at least have one question, hopefully more, but to follow on what everybody said, because there was a question yesterday, but this room's a lot more full than it was yesterday, about, can we afford this? Like everybody said, we're doing this because we believe we can win, but want to assure you that we've thought about what if we don't. We don't want to just get in an echo chamber and just tell ourselves that we have to win. We have a 100% chance of success. Because unfortunately, we do not have a 100% chance of success. It's a great case, has been outlined here. We're going to win, but we've thought long and hard, what if we don't? What if we lose? We have the funds to go through with this. We're not bankrupting the academy. We need more funds to make sure that we go through with this. But I want to just assure everybody that we're very cognizant of that, and we're financially conservative to make sure it lasts. The last thing to say, I've had several people ask, hey, the board's changing over, we have new presidents, how's any of this going to change the Envision suit? Not at all. There we go. Questions?
First over here.
Scott Rainier, first off, thank you for a great summary. Really solidified things to me. Thank you all for the talk, the boards, people that having the courage to do this. But my kind of off Dr. McNamara's question yesterday, what I am thinking about is short-term, near-term, mid-term, long-term, next steps. I know it's just more of a legal question, but clearly these corporate medical groups, when I'm working for now, I won't mention Envision by name. So if they're watching, they can fire me over this damn thing on the live stream. But how do you think that the Envisions, the Team Health or whatever, what do you think their strategy will be to fight us this time? And then what are the steps from that?
Well, their motion to dismiss said, we're legal, this is not an entity for the courts, this is an entity for the California Board of Medicine to decide. And we've had conversations with the California Board of Medicine. I have notes from one of their webinars where they compliment people who bring the cases to court. They can go after the doctors, not after the corporation. So that's their argument, saying this is not a proper suit. Again, that's a risk, but we think we have a pretty effective argument that it's not because of what we're saying here. We want to, unveil this sham professional corporation. The doctor who's on the professional association list, his business address is Tennessee. We dug up a report where he said 90% of his practice was in Virginia, 10% in Florida. That means 0% in California. So I think one of your other questions is, and the board is looking to, what if we win? What if we lose? And that's a long discussion. We have to look towards the future. This is Southern California. I can tell you there's a strong group down there, the Independent Emergency Physicians Consortium, okay? One of the principals in that, Ronnie Leave, I've talked to her. I think she's the current president. They're very engaged in this case. If some of these contracts open up, obviously we could take Placentia right back into the PG fold, but with their help, even PG or not, it's not rocket science to run your emergency department contract, folks. All right, you're not hiring nurses, you're not building the physical plant, you're not paying the electric bills. You're going in as a doctor and you're seeing patients, and RCM company is taking your charts, coding them, collecting them, taking their cut. It's not rocket science. It's why we became prey to this whole exploitative arrangement that we're under, because we were easy, okay? So, and all these people that started these companies, they are not as smart, and I can tell you as an academic chair of the doctors that are now going into emergency medicine. Okay, we have the best and the brightest, and they're so committed. I mean, our residents, social justice, and then they're getting screwed. Like, that's why I'm involved, right? It's just not right. This is wrong. Our moral, I said to the FTC that the moral code of an emergency physician is not in sync with the profit motive of private equity. That's a bold, that's right there encapsulated. We don't go into emergency medicine to make a ton of money. We go in there to serve the homeless, the poor, the victims of violence, substance use disorder. And we have this industry, it's a sacred place. They don't belong in that sacred place. So that's what AIM's trying to do. I see Mitch Lee from Take Medicine Back, another organization. Same thing, let's get private equity out. Your question.
Thanks, Bob. And I think one question that people have asked is, what if we lose? I think we've also heard that this is going to be a multi-pronged approach. This iron is in the fire. Let's keep going, but we are going to look for other wins, other approaches. And you just approached this, what if we win? That's actually the bigger question to me, because when things break down, or Envision leaves California, or Envision goes bankrupt, as it very well may do, split the company into the low-income neighborhoods, create that company, and then split it off, and then bankrupt it, and leave the poor and low-income neighborhoods with a nurse practitioner only, or something. Is the PG essentially ready to bring into the fold like all of these groups and get them ready to go in terms of running their own practices?
Yes. So before the takeover by corporate practice of medicine, most groups were independent, okay? There were hospital employed groups, and there were a lot more independent groups, okay? It's actually a lot easier to be an independent group now than it used to be. We've got very good third-party coding billing companies, and it's much easier to get MedMal and a variety of other types of tasks. And now you have the AAEM-PG, which was formed explicitly for this purpose, to help you run your group better and help start up a group. We also have a lot of very powerful, effective, moderate-sized independent groups throughout the country that can certainly expand and take more into their practices. But we can start up plenty more as well. So what Envision's response, as we're 5 months into this lawsuit, a big part of what they're saying is that we've got it all wrong, and that actually they're just a management company that's just providing some practice management services to this Glass Beach physician group that is contracting with them. They're not really in control of anything. If a judge agrees that their structure is not correct and that this is just a shell and that this you know, that this is a way to avoid breaking corporate practice of medicine laws, then they're going to be forced to actually do what they say they're going to do. I have no problem with Envision pitching its services to the physician group that controls their hospital contract, that controls their insurer contracts, that controls their physician professional fees, and has the choice whether or not they want to use Envision or many other practice management companies, or use a local practice manager, or whatever they want to do. That's fine. But Envision makes way, 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 way less money if they don't control your physician professional fees and they don't control you. So it's not a model that's going to work for Envision. So if we win, Envision has to change their model. If not, the state attorney general is not going to be very happy with them, or the judge, okay? And there's going to be escalating and escalating and escalating penalties. Now, we're not even asking for any money. We're asking for declaratory judgment that what they're doing is legal. Now, we hope if we're successful, the judge will feel inclined to grant us attorney's fees, but there's certainly no guarantee that that would happen. If we win, Envision can't do business as a contract group in California. They can just be one of many, many entities that currently exist for people to contract with for other help. Hopefully, the other contract groups that are operating in California will recognize that since they're using essentially the same structure, that that's illegal as well, and they'll change their practice. If not, we will need to either bring that to the courts, or hopefully the state attorney general will enforce that to these other companies. Hopefully, over time, other states that have strong corporate practice and medicine laws, it'll start trickling down to that as well. But again, what we might need to do is use the precedent that we're setting in California to bring action in other states, either through the courts or through state attorney generals. So things aren't going to change completely across the entire country, across all groups overnight if we're successful. It's the opening salvo, but I would say that this is the most important action that emergency medicine has ever taken against these profiteering corporations that exist to exploit you.
Okay, one more.
Right.
There's nothing else in here, right?
It's a coffee break, isn't it?
Yeah, coffee break. So this is important. I'm willing to stay.
Dr. Reiter just mentioned the large impact that a win here would provide for the House of Medicine writ large, and how Envision would have to change their practice. Seeing amicus curiae briefs being submitted by the California Medical Board as well as the college, do you anticipate or have you solicited engagement from Envision's other colleagues, the anesthesiologists, the hospitalists, the dermatologists, et cetera?
Yes. So the first move that the board made was to reach out to other emergency medicine organizations and to the California Medical Association. So as you said, ASAP filed an amicus brief, and the California Medical Association did as well. The California Medical Association actually said they were so thrilled that we did this because of their relationships with critical care physicians, pediatric intensivists, anesthesiologists, and radiation oncologists who have all been burned by Envision or groups like Envision and are interested. So I have already met with CORD, ACOEP, and SAEM, and they are getting back to us. In fact, I have a meeting scheduled with CORD with SAEM for next week. Our ask specifically to these organizations was, number one, an amicus brief. Number two, financial contributions. Number three, post a public statement saying that you are supporting our lawsuit. And number four, put a link on your website so that your members can contribute to the foundation. Once we finish this round, Dr. Jones is taking over as president, and we will work on reaching out. Missy has already made appointments for anesthesia, critical care, pediatric intensive care, nuclear medicine, trauma surgery, and radiation oncology, and radiology. So we are going to be hitting all of these groups because they're being affected equally. And the ask is going to be the same for those four things that we're going to request from them.
So I think to go along with that, right now, as Bob mentioned, we're somewhat at a holding pattern because most of what's been, they're trying to get it tossed out, and we're there. Once we get past this stage, I think that's when we're going to see I know that's when we're going to see more outreach, but I think a lot of these organizations are holding back right now. Because why put money into this if it's going to get thrown out of court next week? Now, again, we don't believe that, but based on some conversations, we have very high hopes. We're being very aggressive. I think we're going to get a lot of support. The fact that we haven't gotten it right of this second, I don't think is of too much concern. It's coming. And to answer your question, yes, we're aware, we're reaching out, and there's going to be a lot of support for this all throughout the House of Medicine.
We have even had small groups approach us. For example, I was approached by the Latino Physicians of California, the Latino Physicians Association of California, saying we would like to submit an amicus brief in your favor, but we have such a small budget, we can't afford to pay an attorney. So we've actually are asking CMA, look, you've already written an amicus brief, can you do this for them really cheap? Because, I mean, any organization that files an amicus brief in our favor is definitely a help to us. But my point is that even other organizations are reaching out to us now because they are learning about the lawsuit and they know that they're impacted.
I will say that I did have some discussions with the anesthesia head legal guy and their state advocacy group. They have some conflict, right? They have leaders in private equity and they have members in private equity. When you look at the arc of emergency medicine, by forming the American Academy of Emergency Medicine, the leadership of the college has changed. You do not have any of the big players, currently as presidents, vice presidents, whatever, and that's probably why the brief came out and why the statement came out. By us forming and calling them out, calling the shots, saying why that person is conflicted. They're making money off of the members. Why should they be on the board? We've been able to affect a change in the college, and that was one of the intents of forming the academy. Now, anesthesia is not there yet. I can tell you the hospitalists are gone. They are completely co-opted. I spoke to the guy that termed the coin hospitalist from UCSF, David Williams. He was their president. I sent him the rape of emergency medicine. He said, our board's already dominated by IPC, the hospitalist company. So I don't know if we're going to get help from them. Hopefully anesthesia will do something, vanilla kind of statement. Durham is engaged with Take Medicine Back. Celeste Conda has great articles on the effects of private equity on the dermatology patient. I think we're a little more important than dermatology. We've got some anesthesia colleagues are with us who are looking to form an AAM type organization in anesthesia if the ASA doesn't step up to the table. Radiology, a little bit of connection. So this is good. I mean, at the FTC panel, Celeste, he testified, there's multiple specialties giving input. So it's the whole movement against private equity. It had to happen. They don't belong in healthcare. They absolutely don't belong in our ED. We'll take one more question, and then you'll have 2 minutes to get coffee for the next one.
The message that y'all are projecting is amazing, that we are fighting for our patients. And I realize that in America, doctors have kind of a PR problem. And are we just hoping that private equity is a bigger boogeyman than doctors? Or is there going to be a PR campaign to say, we're trying to fight for you, our patients, these guys are bad, we're actually not the bad guys. I'm just curious how we're going to...
Yeah, I can say absolutely. We're not just hoping. If you've been to a recent board meeting, most of our discussion is about that publicity, PR. How do we get this message across? I think we all know that sometimes the message gets across the wrong way. And so one of the things that Lisa just pointed out, the social justice part of this, right? Who's suffering? It's the patients. What Bob said earlier on, one of the reasons we like that it's in California isn't just because of the strong protection of laws, but let's look at the political climate in California. So no, there's not just hope. We have plans in place to market, to put the message out. And I want to make you aware that we're well aware of that. We're not going into this just with a hope and a prayer. This is a very well thought out plan, multifaceted.
So this court case is doctors versus private equity. I think we win. Okay. Now, there's been what you're saying is like, you doctors are making a lot of money. And we struggled with this in the early days of AAM, going to CMS, saying like, you're paying $200 for a doctor and a doctor's only seeing $100. Like, what I'm saying, well, all right, so what do we care? The doctors are getting screwed. And we've eventually been able to build it up to now. I don't know if you read any of the articles that are out there, okay, about, what's going on. The whole surprise billing thing, right? we were smeared as a specialty because we allow private equity into our space. Okay, we created an unholy alliance with them. Zach Cooper, economist from Yale, condemned emergency medicine as having high out-of-network billing. I personally contacted him and said, it's not us, it's the corporations. He did more research, showed that EmCare and Team Health, business strategy. Zach Cooper now believes emergency physicians are victims and says that, and he's put that out on Twitter. He's been convinced that these doctors who I thought were part of it aren't really part of it. The insurance companies, when United Health counterfiled the $100 million lawsuit for upcoding against Team Health, they specifically say, and the doctor has no idea what is being billed to the patient. So the word has gotten out that we're victims in this to some degree. And, we were the perfect setup, right? Like I said, we're the ones that chose emergency medicine knowing we're going to take care of the uninsured, the homeless, and the entrepreneurs, got into this and took us over, abused us. And I think there's now a realization in the press, okay, and in the minds of people. The insurance companies know the game. I think, we got to work on the image, absolutely, but I think there's a lot of people that recognize it's not the bedside doctor who's the evil player here. It's the business person that took over our practice.
Can I add a line to this? Several of us spoke in front of the Federal Trade Commission and Department of Justice at a healthcare listening session on mergers about April 14th, about a week ago. So that was myself, that was Dr. McNamara, Vicki Norton, I think, on behalf of AAEM officially, yes. And even the ASAP, Jillian Schmitz, and their CEO saying kind of the same chorus. Now, I took the opportunity because the HHS secretary, Javier Becerra, is they're doing an investigation on the billing practices, the predatory billing practices of 2,000 providers. So I took that opportunity we don't like the word provider, I took that opportunity to say, please do not conflate us with providers. I'm a physician, and I took an oath to patients. Corporations do not. And then I went on to talk about the Nazi original terminology, which was from demeaning Jewish physicians. But I didn't conflate us. I wouldn't talk about the nurse practitioner and PA issue. They're using providers to conflate us with these evil corporations and NPs. So I think we need to launch on that and use the term provider and say, let's distinguish us on that note.
All right, folks. Great session. Thanks for your help. Thanks for the
Donate money to the foundation.